On this episode of LVAD Talk, we speak with perfusionist John Stratton. We discuss what is a perfusionist, what is his role in the LVAD and transplant surgery, how LVADs work, the difference between the HeartMate 2 and the HeartMate 3, and we discuss the freedom under vest. Let's have a conversation with John Stratton.
I'm good.
I'm good. I'm good.
Right. What are we talking about today?
Life as a perfusionist, what you do, how you help other people like me, your role in LVADs and transplants, and then just what's going on in life.
Okay, I can certainly do that. Firstly, I am a cardiovascular perfusionist, and basically I operate the heart and lung machines doing open heart surgery. And nowadays, that involves a lot of different types of procedures, where back in the day, it was just, routine CABG, that's a coronary artery bypass, or valve surgery. Now, it's implanting VADs, LVADs like yours, putting people on ECMO, which is an extended life support similar to it's basically being on bypass for more than a couple of hours, which can go on for days and weeks. And a lot of other little things that we do. Another procedure perfusionists do is called HIPEC, and that's where we're infusing chemotherapy drugs through a person's abdomen to help to kill whatever cancers may be involved in that in the abdomen. And we also do something called angiovac, and that's basically you may develop big blood clots in your larger veins in your body, and we're involved with helping to remove those. Mm-hmm. So it's pretty busy, pretty busy.
I want everybody to know that John was my perfusionist when I had my surgery. Mm-hmm. So he had me laid out on the table. So I want to go into more of the VAD surgery and your role in the VAD surgery.
So typically it requires two perfusionists. One perfusionist will be operating the heart and lung machine, maintaining the body while the surgeon is working. The other perfusionist is getting all of the LVAD equipment together, in some cases putting certain parts of it together and preparing it for being implanted. But yeah, you definitely need two people for that. The LVAD equipment is fairly simple, but you have to take care to not break anything, keep everything sterile since it's going to be implanted in the body, and all of the paperwork involved with that.
Awesome. So how different is it when it's transplant versus a LVAD?
So transplants used to be fairly simple procedures. First of all, in your typical bypass situation, we put the patient on bypass and we're supporting the hearts and the lung. And at some point, we shut the heart off. Mm-hmm. We deliver a solution called cardioplegia, which means stopping the heart. And then we'll cross clamp and do whatever the procedure is. With a heart transplant, that's not necessary. So it really takes one of the steps out of the whole process. Literally, the surgeons cut out the native heart, which in this case is in really bad shape. In the case, of course, with LVAD patients, we cut out the native heart, which also has the LVAD pump attached to it.
Right. Mm-hmm.
They cut it out in such a way where when they bring in the new heart, the proper orientation. The reason why I say it was easier in the past because person would, donor heart would come in, the the recipient's heart has already been taken out, and then it's just a matter of sewing the anastomosis. So anastomosis is a connection. Like if you connect two pipes together, that's called an anastomosis.
Yeah.
So, and then, turning the new heart on by just letting warm blood circulate through it, you might have to shock it. And then there you go. It's a little bit more difficult with LVAD patients because now you've had a person who's already had surgery, major surgery. They have the LVAD. They've been on all of the different types of medications that you have to take. And over time after surgery, you have adhesions that develop. This is where the tissue, scar tissue kind of grows and makes everything kind of glued together.
Mhm.
So when it comes to getting the native heart out with the LVAD equipment, the surgeons have to go in and kind of dig around and dissect very delicately so that they don't cause too much bleeding. And that can certainly take a lot of time. And it has higher risks of bleeding because of all of the different cuts that they have to make in order to dissect out the native heart and the LVAD.
What is your role after a patient goes through surgery?
It depends. If it's a patient who does not have any of our mechanical devices, then not much at all. They're taken over to the intensive care unit, and the ICU nurses and the doctors manage the patients over there. If it's a patient who has to be maintained with one of my devices, whether it be an LVAD, ECMO, there are various other machines that we're involved with, then we will come over to the ICU, which is where I am right now. I have a couple of patients here now, and help manage those patients until they are ready to leave the ICU and go to a step-down unit.
Okay. Okay. So what advice would you have, or what kind of career path, if someone was interested in doing what you do, how would they get involved? How would they get started?
So perfusion is a very specialized field. There aren't that many perfusionists worldwide, and there aren't that many schools. There are a few schools here on the East Coast. Basically, nowadays it requires a master's degree. So it would be in your best interest if you were going to pursue it to get a bachelor's degree in some of the biological sciences so that you can have a firm foundation for this work. We actually on a daily basis incorporate chemistry, pharmacology, biology, electronics, engineering, all different modalities in the work that we do because we're dealing with people and machines and drugs. And so we have to know physics. We have to have all this stuff at our disposal right away. So anyone who's interested in being a perfusionist should be well versed in most of the sciences and be able to be conversant in all of the sciences. And then you probably would have to relocate if you don't live near one of the perfusion schools. You have to be prepared for that. And then as far as the career itself, you have to know that you want to do this.
Mhm.
You know what I mean? You gotta know that you want to do this. This is not a career for weak people.
Mhm.
It's not a career for people who are flighty, because in many cases, whether or not a person is going to make it is up to you. So it's a very serious job. It's been fulfilling for me. It's been a blessing. I work long hours. It's Sunday. I'm here.
Right.
But at the end of the day, you've done good work. You know that you've done meaningful work, and it's very gratifying.
That's good. That's good. So where did you go to school?
Excuse me, I'm from Philadelphia. So there was a program in Philadelphia at Hahnemann University. That program and that hospital, as a matter of fact, have closed down. I think the next nearest hospital with the program is in New Jersey, South Jersey, right across the bridge at Lourdes, Our Lady of Lourdes Hospital. I think they have or Cooper, I think they have a perfusion program now.
Awesome.
I graduated in '99, so I've
Okay.
been doing this for 22 years. Yeah.
And is very good at it. I could be a
Look,
witness.
after all this time, I better be.
You tend to grow kinship with people who have seen you open up from the inside. So
You know, it's so things have changed since you got your VAD
Mhm.
for us. When they began the heart program, the VAD program here at Centera, um, it was just the perfusions. We did everything. You know, we did this. We did the implants and the surgeries. We managed the patients in the ICUs. When the patient left and then came in for clinical visits, they called us down to interrogate the machines.
Mhm.
If you got called into the emergency room, we had to come in the middle of the night to the emergency room. Uh,
I'm guilty of having that caused a couple times.
but that was the gig. But the thing was at that time, none of the nurses around, nobody in the hospital knew what an LVAD was.
Mhm.
You know, they were all scared of y'all. You know, oh, we don't know what to do. Call perfusion. And most of the time they didn't need us, right? But that's changed drastically, as you know. I mean, you almost never see perfusion in the clinic anymore. The nurses and the docs and everyone have become proficient, and they don't really need us anymore. It's so bad sometimes that when we walk in the room, they act like we're not supposed to be there. It's like, no, these are still our machines. We still do this, you know. But it's a lot different. Yeah.
So how long, like this is one thing I'm not sure of. How long has the LVAD as a device been in service? That
Uh,
you
I don't know the exact date, but I do remember the devices.
Mhm.
So let's see, I've been doing this for 22 years. I'd probably go 10 years before that. So we're looking at the late 80s.
Okay.
Um, so one of the LVADs, it was humongous, right? So you have to understand there's a distinction between implantable devices that we open the chest and place it in the body versus external devices that did the same thing, right? So when it came to the internal ones, there was a Thoratec before the HeartMate 2, which is what you have.
Yes.
There was a much bigger LVAD. It was huge. And when the HeartMate 2 came out, it was a revelation because it was so small.
Mhm.
Um, and then later on with the HeartMate 3 and the Heartwear, they're really small devices. Excuse me, I'm sorry.
No problem.
So yeah, we're probably looking at 30 to 35 year time frame where they were used regularly.
Mhm.
Um, and probably within the past 20 years to the degree that they're being used now.
So what is and this is a question that comes up a lot. What is the main difference between the HeartMate 2 and the HeartMate 3 besides the size?
So it's really the way that the blood is being propelled. In the HeartMate 2, I want you to think of it's probably more like a boat motor. We have the propeller.
Mhm.
They call it axial flow. So it's really like a, a just like a propeller on a plane or on a boat. Not exactly, but that same idea. We have this thing spinning in solution and the blood is passing through it as a result. The HeartMate 2 the HeartMate 3 is using centrifugal force.
Okay.
So basically you have a disc that's spinning in solution. And as that disc spins, you have the blood coming in one side and then it's being propelled out. So it's just a different way of getting the blood to move through the device. The benefit of the centrifugal with the disc spinning is that you have less heat, there's a lot less friction.
Mhm.
Also, one of the benefits of it is that it can be much smaller.
Mhm.
Now with the HeartMate 2, when it's sitting in your heart, it has this long cannula. Can you guys let me move this camera down? It's this long cannula up into the left ventricle.
Mhm.
And then the rest of the device is sitting in a pocket that they created in your abdomen to rest it there. The problem is that as the heart moves, it kind of, moves that cannula around. And in some people, it caused distortions in the way the cannula sat in the heart and caused
Right.
problems.
Mhm.
With the HeartMate 3 and the heart device, they're so small that once they implant it in the heart, this is the heart, it just sits. Well, I got big hands, but the idea is that the device is so small, it just sits up in the heart, and the heart is allowed to move anywhere, but the device moves with it.
Right.
So
Right.
the direction of the cannula inside, no matter how the heart moves, is still in the proper orientation.
And I went through that with early on after my surgery,
Right, right,
where mine is like actually like stitched to sutured to one of my ribs to keep it in place.
right, right,
Yeah.
right. So the technology is better.
Mhm.
Um, it's because it's smaller. But again, the HeartMate 2 was a revelation when it came out because it was really much smaller than the
Smaller than it
original.
was. Right. Mhm. Power wise, is it any different?
Not too much, not too much. I think with the HeartMate 2, because of the type of propeller,
Mhm.
you have higher revolutions, right?
Okay.
But with the centrifugal disc, the centrifugal pump where the disc is spinning, it requires less revolutions per minute to get a similar amount of flow.
Mhm.
So again, if you think about your HeartMate 2 like a boat motor, as opposed to the HeartMate 3, which is a disc spinning in solution, um, it requires more RPMs for you to get the same flow that somebody else has with the HeartMate 3.
So theoretically, would their batteries last longer?
Well, marginally,
Mhm.
right? Because we're still talking about spinning a disc. We're still talking about doing work and going up against resistance and things of that nature. Um, the it should work. The battery should go longer, but not by much.
Mhm.
It would.
Oh,
I still would think in terms of the battery not lasting long, and that's just for as a perfusionist, not trusting any machines or devices.
mhm.
I don't think, okay, well, I have 12 hours on this battery. I think, oh, I got 9,
Mhm.
right? Just
Exactly.
change it out.
Mhm. Exactly. So, are the batteries the same?
Exactly the same.
Okay.
Now, I had some word from one of the reps a year ago that they're going to be making some changes. What might be some very good changes for people who are getting the new LVADs. I don't know if it'll be, I don't know if they'll be able to retrofit people who already have the HeartMate 3 and HeartMate 2, but I think they're going to a single battery setup. Um, and it's supposed to be a lot more streamlined. The controller is supposed to be uh, more like maybe your iPhone
Mhm.
as far as the compactness of it. Um, I think I was told that John, don't tell anybody about this, but I don't work for.
We won't tell nobody.
But at any rate, and the same with hardware. They're supposed to be coming out with some new peripheral equipment that should be a little bit more streamlined. Their controller and batteries, even though the batteries are lighter than the HeartMate batteries and smaller, but they're thick, and
Mhm.
that controller is pretty thick.
Mhm.
But hopefully, within the next year or so, LVADs will have smaller, more compact, lighter equipment.
Mhm. How is the decision made of which model LVAD a person gets?
I only can tell you about how we kind of do it here.
Mhm.
At one point, when it was a choice between the HeartMate 2 and the HeartWare or HeartMate 3 was about how big the person was. That the thinking being that a bigger person can take the HeartMate 2, and you want to put the HeartMate, well, at the time, HeartWare in a smaller patient. But the HeartWare and HeartMate 3 can accommodate people as large as me. And I'm a pretty big guy. So I think now is pretty much patient preference. They're educated on what the devices are, what they have to deal with, and they kind of pick and choose. So I think today, because now you have to understand that Thoratec, well, now it's Abbott, they've gone away from the HeartMate 2, right? They switched technologies to the HeartMate 3, which incidentally was a copy of HeartWare, because that technology, the centrifugal technology, is just better. So when they tried to acquire HeartWare and couldn't, they decided to make their own device similar to the HeartWare device. Between those two, the HeartWare is a little smaller. The physical pump that we install in the heart is a little smaller, but they work the same way and they both work well.
Oh. So do you have anything that you want to talk about, promote, present while you have we have some time today?
So I think many of the LVADers really in the world know about my Freedom undervest. What people may not know is that it was people like my man Sean here and other LVAD patients of mine who gave me the motivation to come up with it. Because when we started this program, we got to know all of our patients personally. Sean and I are friends. And it got to a point where I was tired of seeing them suffer. A lot of people during those days were coming back and having reoperations because they had driveline infections. One of my friends, his dog got to his driveline, chewed it up, not once, but twice. So, and back in those days, the LVADs, particularly the HeartMate 3, they have cords where you can snap in and replace the cord. Well, back in those days, it was just one cord, and if it got damaged severely enough, you had to replace the entire pump, and that required a whole new surgery, weeks and weeks of rehab. It was just a nightmare for a lot of them. So, what I did first was try to find a way to protect the driveline with the driveline protector. And I thought that was really going to do well. It worked fantastically. But nobody really bought it. I had 100 of them made, and I tried to promote them, and a few people who we knew had them, and they liked them and they worked. But then the idea of the LVAD shirt came about when I was called into the ED one day for one of my good friends who was having trouble. And I told him what I was trying to do. He said, well, you know what, John? You need to come up with something for when I'm out in public and I need to go to the bathroom. I said, what you mean? He said, well, when I'm home, I have a hook. I can take my bag, hook it on the wall, then I can take my pants down, do whatever I got to do. But it's not that way in public. And so they got me to thinking, well, how can we do something where he doesn't have to carry that bag all the time, and you still have the freedom to do whatever you want to do. The very next night, another young man came in, and he was so scared. He was a real young guy. Apparently he was sleeping. And when, as a lot of people sleep with the bag, right, in the bed. So he was sleeping, and he went to turn over one way, and the bag and the cord went the other way, and his pump stopped.
Ooh.
Yeah. So he panicked, came to the ED. I got there, was talking to him, and I was thinking, we got to do something about this sleeping situation. So it was a combination of wanting to protect the driveline. If you drop the driveline, that's why they have that adhesive tape on it. Well, you know all about it. to keep from pulling on the driveline site if you drop the equipment. But the adhesive tape messes with people's skin. A lot of people can't take it, right?
Yes.
So I was looking at all these different things. The fact that I want to protect the driveline, protect the wound site, give people the freedom to, go to the bathroom and be able to sleep with their equipment without worrying about it getting all tangled up and things like that. And that's where the shirt came up. And the idea is that when you put on the shirt, you can go on the inside, grab your equipment, and put it in designated pockets. And then all of your cords can also go in this larger kangaroo type pouch. And once you close it up, everything is self-contained. Everything is in the shirt, no exposed wires, and the drive line moves with your body. Same idea with that centrifugal pump. Wherever you move, the cord at the wound site is going to move with you, so there won't be any pulling. And that's done well. It's done very well. It's been difficult to keep up with demand because it's such a small operation. And I do have some customers from around the world, not a whole lot, but Europe, some in Asia, Canada, and of course, most of our patients here in America are our customers.
I find like I like it when I'm out doing something where I don't want two bags. So let's say I'm out and I got my camera equipment. I don't want to have the driveline bag and my camera bag. That's like doing double duty. So I can tuck everything in that shirt and then just wear my regular camera bag. And it also takes a lot of the pressure off the one shoulder.
Right.
Which is a great thing. Which
was one of the focuses. Now, I've come to learn that the undervest, that's what it's called, the Freedom Undervest, it's situational for some people. Some people wear it all the time, no matter what. Then there are people who, like young women, who want to show off their figure. They, my shirt is not going to help them because it's going to make them look fat around the middle because of the equipment and where it sits. So, and some men are that way too. Some very thin men have trouble with it because it makes them look bulky and they don't like that look. So it becomes situational where, okay, I'm home, I want to clean, I want to go to the gym, I want to play golf.
Yeah,
I'll put it on now.
Yes.
Right, I'll put it on now. So I'd like people to think, even my young women who are, concerned about their figure, how it looks, there are times when it's going to be useful for you. Like if you are at the gym, or if you're going to the grocery store and you got a heavy coat on, or if you're home doing housework, it's better to have something like that instead of having a bag swinging all the time.
It's always good to have options.
Right, exactly. Yep.
Well, I know you're at work, so we're going to go ahead and let you save a few lives today. Tell everybody how they can reach you and order a Freedom Vest.
So the website is www.medimaterials. That's Medi, M-E-D-I hyphen materials, MEDI-materials.com. The stock is very low right now. I'm placing an order. We should have more in stock within the next 8 to 10 weeks. I do have a few shirts available in certain sizes, but like I said, it's been difficult to keep up with the demand because the time it takes to construct the shirt. I'm blessed to have a great manufacturer who loved what we were trying to do for the LVAD community and took it upon themselves to help design the shirt once I gave them the rough draft. And they've been committed to producing as many as I want whenever I want. So that's been a blessing.
I need a black one.
You will have one.
All right. All right, ladies and gentlemen, this has been LVAD Talk. I am Sean, your host. We have just spent time talking to the great John Stratton. You guys have a great day.
Take it easy. It's been a pleasure. Thank you.
Thank you, sir.
All right.